Dani Gasparini, and welcome to this segment of Penn Voice. I'm joined today by Mehta, who is the LEAP Institute Director for the San Mateo County Health System. Viral, welcome.
Thank you.
I'm always excited to have somebody from the San Mateo County Health System. I think it's one of the most innovative departments within our county, but then I happen to think our county's pretty innovative in and of itself. So let's leap right into telling people what LEAP stands for and a little bit about the program.
Great. So LEAP stands for Learn, Engage, Aspire, and Perfect. And LEAP is the health system's method and approach towards continuously improving every single thing that we do throughout the organization.
So it's kind of like this methodology. It's kind of this process. So you look at all of your health system programs and how can you improve them?
Right. And we basically hone in on which problems are most important for our patients, for our clients, for our community, and how do we actually take each of those problems and put it through a very disciplined, collaborative process of problem solving. It involves people that do the work. It's not a sort of top-down management approach. It involves management as well, and management is important, but so are the people who actually have the deepest insight about the work that they're doing. How do we involve them in the problem solving?
So you're probably the auditor of program delivery and program efficiency and partnership within the county.
Well, we think of it, as more of an enabler, and how do we support our divisions within the health system to actually do their own improvement. So as opposed to us coming in and being the people who do the improvement or ensure that they're doing the improvement, how do we create a context and an environment, give them the right support, tool sets, skill sets, but also mindsets, so that they can actually do the improvement themselves.
So what's your background then in knowing how to do these process engagement and improvements?
Yeah, so I'm a trained engineer and a technologist, so definitely have that background that supports me in being able to kind of take this analytical approach.
Right.
But it's also a very humanistic approach. So, my background, since about the age of 19, I've had this clarity that I really want to work in local government and the nonprofit sector. So I've been doing that in my career. And before, I was applying really the technology skills, and at some point really recognizing that even before you put in technology or outside of technology, that's just one piece of the puzzle. And there's a broader set of things that really, if you want to holistically improve the entire organization. So I became attracted to taking that lens.
Well, this is pretty innovative for a government agency to sort of look at how we provide services bigger, better, faster, probably more efficient.
Yeah.
At the end of the day, the benefit is the patient. It's the person within your county health system. So give us some examples of some of the things that you've been able to do to either reduce time for patients to be either treated, diagnosed, or receive services.
Yeah, so several examples come to mind. So one is one of our early works, one of the early examples that we worked on was within the pharmacy. And so it was taking about 2.5 hours to actually get a prescription filled. And we just started seeing the lines, and it was just, our staff was frustrated because they wanted to be a part of a better system. And within a short amount of time, they were able to bring that down to about 50 minutes. And actually, I just checked, and right now it's down to 25 minutes. So even after they've continued, the staff and...
Can I use your pharmacy? Because
Yes.
I typically wait a little bit longer than that for a private pharmacy.
Yeah, and these are problems that exist everywhere.
Right.
And in fact, LEAP comes from the term lean originally, which is basically the Toyota management system. And Toyota for decades was known as this company that people were just curious, how are they year in and year out so successful? And so people started studying it in the 80s, the management school folks, and they found that there are things that they do that are just radically different. And a lot of their problem-solving approaches and a lot of their real engagement approaches throughout the organization are very unique. And so it started spreading through other industries, all of automotive, but also, other manufacturing industries. And in the early 2000s, hospitals, particularly, there are a few kind of cutting-edge hospitals that started doing this in the early 2000s. And then we got a chance through the California Healthcare Foundation in around 2008, 2009 to actually experiment, and they funded something that allowed us to experiment in multiple counties throughout the state. And so we got a taste of what was possible when you bring a collaborative group of people together. There's a very disciplined process, and a very scientific process that's based on actual observation.
Right.
And it's based on understanding what the actual problem is, having a real measurement-based way of also understanding how we can see if we're getting better.
Right.
What are the root causes? And how do we address those root causes, and what are we going to do to address those root causes? So it's kind of a very science-based approach to improvement.
Right, and so the key to your success is, one, as you had said, going into a department and saying, hey, we're not here to try and change the way you do things and how you are with your delivery of systems. We want to improve it so that you're able to reach more people. So you've demonstrated sometimes where it's cut down time for patients and or individuals seeking services. Have you tracked any of your revenue savings or expenditure savings, I should say?
Yeah, and that's also been a part of the work, especially in the medical center with where we treat most of our patients. So how do we make sure that the things that we need to do in order to get funded for providing the care that we're providing, there's a lot of back office operations that have to take place in order for that to happen. So how do we make sure that those are actually also go through the same approach of problem solving? How do we make sure that they're streamlined? How do we do it faster? How do we do it such that the handoffs are more efficient? And that's also something that has seen the benefits of applying this approach.
And probably about a month ago, we interviewed the gentleman who's in charge of transferring the electronic medical records within the health system. I imagine that's probably going to be a huge benefit to delivering service in a faster, more efficient way.
Absolutely.
As now your electronic medical records for your patients are readily available.
Yes, I mean, we live in a world of information, and that information is increasing exponentially.
Right.
20 years ago, we didn't have the same kind of digital information available to us, but it also represents a question of how do we make sure that information is available in the right place at the right time while I'm doing the task in which I need that information.
Right.
So fundamentally, all of the technology work is related to processes. You know, it has to be integrated into how we actually do things. And so, yes, these things are very linked.
Well, and something that we really didn't talk about was the quality of care. So the quality of care is going to improve by having these kinds of leap views and processes, kind of testing what the old way, if you will, of doing things and kind of being more innovative in how you deliver the service as well. So again, the patient not only benefits from the reduction in time and also the way in which they're going to receive the information. They get sort of that one-stop shopping. You were talking about a doctor being able to immediately get other reports for that patient in that office visit. And then the quality of care is certainly going to improve.
Yeah, and in fact, in the example that we're working on as we speak, we're able to take down the amount of time it takes to get a patient a specific specialized set of information and guidance. So for instance, someone who has needs an adjustment to their blood pressure medication, they also have some other complications, and the primary care physician actually needs the consultation of a specialist. That consultation can take weeks sometimes, but we've actually found a way, and we're working on it and experimenting with it as we speak, to make it, knock it down to minutes. So within a half an hour, while the patient is there, we're able to actually adjust their medications and whatever else that might be needed for their treatment. So for someone who's, for instance, experiencing pain and has lost some mobility and is actually losing work time, then for those folks to be able to have immediate adjustment so that they have what they need.
So, and we just have about 30 seconds left. So this is something that the community won't necessarily see. They certainly will in the time and the reduction in quality of care that they're going to receive. But they won't know that this process has taken place. So I really appreciate you coming and telling us how the county is sort of viewing making itself better and more efficient. And at the end of the day, it's all about the patient and the delivery of service. So thank you so much for giving us sort of this behind the scenes look at how you improve the services within the county health system.
Thank you, Dani. It's a pleasure to meet with you.
Well, and we look forward to sort of hearing more about the other views and some of the other programs that you're impacting. So we certainly want to invite you back. And hopefully we'll invite all of you back to see us next time on Penn Voice.